Hi there my friend, it's Suki here. Take control and be happy every day. Today, I would like to talk to you about methadone. Now, if you haven't already subscribed, make sure you hit the subscribe button and give it a thumbs up. Without further ado, let's rock it! Today, I would like to talk to you about methadone. Methadone is one of the medications that is used in opioid maintenance therapy. I used to work in the largest methadone dispensing pharmacy in Victoria, Australia. And I see methadone to help many people getting back their lives. Many pregnant women who are on heroin also go on opioid maintenance therapy so that the doctors can monitor them closer and ensure the safety delivery of their baby. Now, one's messed up life is in order because of opioid maintenance therapy. So if you're struggling from heroin to opioid addiction and want to live a normal life again, don't hesitate. Make an appointment to see a doctor now, and your doctor will determine the suitability of methadone for yourself. The goal is to get your life back in order, and if methadone is deemed inappropriate, the doctor will recommend something else, an alternative medication for you. And another alternative medication is the buprenorphine. I will talk about that more in another video, and I'll put a link down below for you if you want to know more about that medication. So, what is methadone? Methadone is used to treat severe chronic pain and is also commonly used to treat opioid dependency. It comes in liquid form. Pharmacists usually mix the methadone with cordials so it tastes better for their patients. But some people prefer to just drink it like that, and they actually think it's tasty. So whatever you prefer, whatever you like, the pharmacist will usually do that for you. So how does methadone work? It functions very similar to opioid itself. However, its onset is way slower and it doesn't give you the high that you get from heroin, which means you won't get a slump back into withdrawal and cravings as fast either. This gives you more control and your life back. Your doctor will work with you to slowly then taper off methadone to reach abstinence, which means you no longer need to rely on methadone again and you are drug free. So that's the ultimate goal, and you will be able to get there. Now, while you're going through the opioid maintenance therapy, your doctor will be able to direct you to the right counselors and services to help you regain your life back. During this time, you can set your heart down to reconsider and make decisions in regard to your life. What you want to do in the future, people whom you want to cut off in your life that are not good influences, and people whom you want to improve your relationship with, such as your family members. You can also consider returning to study to upgrade your skills so you could get better employment, or you may want to start looking for employment right away. Now, having things to do daily where you have progress in life is one of the sources of mental stability and happiness in life. There are tons of motivational YouTube videos out there that could help you improve how you think and ultimately improve your life. A few motivational speakers that has changed my life that I recommend are Tony Robbins, Brian Tracy, and Zig Ziglar. So make sure you check them out. They are very good in helping people getting their lives in order and creating a better future for themselves. I myself have also created some videos on how to be happy, and videos that identifies bad thinking habits that we need to get rid of in order to have a positive mindset, in order to have a better life for ourselves. So I'll put the links down below for you. Now let's get back into methadone. Now it takes a few days to gain full effect of methadone. So before the full effect kicks in, you may feel uncomfortable. But make sure you do not take opioids, alcohol, or benzodiazepine, as this will increase the risk of overdosing and it can affect the assessment of your symptoms, and will take longer for your doctor to be able to tailor a correct dose for you. Now, methadone can cause drowsiness, especially when you are just starting out with the treatment or the dose has just increased. So please do not drive or operate any machineries if you are affected. And if you do visit any other doctor or dentist, while you're being treated with methadone, make sure you let the doctor and the dentist know so they can prescribe any future medication appropriately. And this is very important. Make sure you do that. So all the best in getting rid of opioid dependency. I have seen many successful cases in my life. It is very positive and very encouraging. There are a lot of resources out there, so make sure you make full use of them. If you don't know where to start, talk to your doctor about it or your local pharmacist. So the first step now to do is to make an appointment to see your doctor and go from there. Pick up the phone and start dialing. Now, if you don't even know where your local doctor is, go through Yellow Pages or go online to internet. Just type in where you live and local GP. Something like that. You'll be able to find somewhere and start getting treated. Now, if you haven't already subscribed, hit the subscribe button and the bell as well. Give it a thumbs up and I would really appreciate that. Comment down below if you use methadone and share your experiences so you can encourage one another. Let me know if you have any other questions or if you want me to cover any other drugs or medications. I will be delighted to do that for you. It's Sunki here. Take control and be happy every day. With lots of love. See you next time.